Now, the other focus today on the show, with more and more schools opening up across the country, various states announcing schools opening, it has raised concerns about the spread of coronavirus. Now, 2 cases have emerged in Kerala schools, which have seen a huge spike days after they began attending classes physically under the COVID cloud. 192 class 10 students of 2 schools in Kerala's Malappuram district have tested positive for COVID following a contact tracing exercises after one of the students tested positive, and then up to 72 staffers too have been diagnosed with the disease. Now, this comes amid the high numbers of fresh COVID cases being reported there in Kerala. Well, let's discuss this now with Dr. Merlin Amoni, Associate Professor, Division of Infectious Disease, Amrita Hospital, Kochi. Thank you so much for joining us, ma'am. This is very, very worrying, seeing the spike in cases in regard to these 2 schools. First, tell us about this.
Yeah, there is a school-based cluster, 2 school-based cluster in Malappuram, that is in North Kerala, which has been described yesterday. So this was basically one of the students of the school became positive on February 1st, and following contact tracing of the student, 178 students and 75 of the school, the teachers and allied staff were found to be positive on contact tracing. So most of them are asymptomatic, and thorough contact tracing was done, and the surveillance measures are being stepped up in the state. So the exact source of origin of this cluster is still unknown, but still the school-based clusters are still worrying, especially because the test positivity rates are still high in Kerala. They were actually starting to drop this week, but the school clusters are really worrying.
Right, absolutely, ma'am. And as we said, this comes at a time, when other schools in other states have announced opening. In UP, in fact, also has announced the opening of all schools and other classes as well, not just for seniors, senior students. So, what more steps? How can schools be more vigilant? Should they, be conducting those rapid COVID tests on students from time to time, just to check if there is a spread of the disease?
So basically, the American Association of Pediatrics had, published the guidelines for safe school reopening, and most of the situations in which the school-based clusters form are from the community itself, actually. So basically, it mirrors the community spread, and actually the school-based surveillance had been stepped up in the state, and especially symptom-based surveillance and the social distancing measures, especially in students. Now the school is open for more than 10-year-old students. So this represents an age group which can equally, spread the virus as efficiently as adults. So now there is evidence that the students less than 10 years or children aged less than 10 years are less effective transmitters of virus. So I think it should not affect further opening of schools, especially for KGs and everything, as far as the evidence is currently on. But the school-based surveillance has to be stepped up. Symptom surveillance and formation of support groups, especially within the school, involving the local bodies, involving the public health researchers, public health personnel, and stepping up the the testing capabilities by tying up with local health authorities also would help in this regard.
Right, ma'am. And the worry with students, even if they don't exhibit too many symptoms, because many families live in joint families. You have elderly people in the household, you have grandparents, and that remains the big fear about children carrying the virus and spreading it to households.
Definitely. About 16 to 20% of the children can be asymptomatic. And also, when we, if we want to step up the symptom surveillance, that too is not recommended by the CDC. This is because COVID has symptoms which can be confused with the usual flu-like symptoms. So just by symptom surveillance, we cannot actually contain the disease. And also, definitely children below 10 years, they are thought to be less effective transmitters. So for children elder than 10 years returning from school, one thing which can be considered is till the vaccine rollout effectively covers the elderly. Elderly can be kept in reverse quarantine. Some measures like that can be considered till the vaccine rollout actually covers the elderly.